This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
It's the #1 killer of people in the United States. 1 in 4 people die of it every year. That's more than 1,600 people a day, and it can be prevented.
We are talking about heart disease. February, of course, is American Heart Month. PRMC is celebrating with events and screenings all month long, and here to tell us more is Dr. Jeffrey Whelan, who is Chief of Cardiology at PRMC. Thanks for joining us.
Oh, it's my pleasure. Thanks.
#1 killer. Wow. Can you define for us what heart disease is?
Yeah, heart disease covers a broad spectrum of diseases. One of them is congenital heart disease, which are defects that children are born with. What we usually are talking about as adult cardiologists is blocked coronary arteries or coronary artery disease. And the heart, just like any other organ, has a blood supply. And if it stops getting enough blood, it starts to malfunction, and ultimately, if the blood's cut off, you will have a heart attack. So that's heart disease in adult medicine is coronary artery disease.
Now, there are risk factors, and some people are more at risk than others. What are the risk factors?
Yeah, so there are basically 5 risk factors, and these are things, some of which you can control and some of which you can't. First of all, diabetics have an increased risk of coronary disease. Your family history is important. I have a strong history of family of heart disease in my family. It's not anything you can get rid of, but it's something to be aware of. Thirdly, high blood pressure or hypertension. Fourthly, your cholesterol numbers, and those are easy to get measured. And finally, smoking.
Which is very easy to control.
Well, I don't know if it's easy to control, but it's certainly one of the big killers.
It's definitely something you can fix.
It's something you can fix.
Mm-hmm.
So as part of Heart Month, PRMC is running a Know Your Numbers campaign. What is that?
So the Know Your Numbers campaign is basically get the information about yourself so you know what your risk for heart disease is. Know what your blood pressure is. Even if you're trying to avoid knowing this, find out what your weight is and try to improve if obesity is an issue. Cholesterol measurement is a simple test that can be done in almost any lab locally. And know what your blood sugar is. Obviously, diabetes being one of the big risk factors, blood sugar is a marker for that.
I'm sorry.
Once you know your numbers.
So that's even more important. Once you know your numbers, then you can figure out what your risk is, and if you have elevated risk for coronary disease, in other words, high blood pressure or high cholesterol numbers or high blood sugar, then you need to start addressing that. And there are different ways to do that. First of all, I would contact your local physician and get some advice from him. But knowing your numbers isn't enough. You've got to act on that knowledge. You got to get out there and start doing some exercise so that you can bring your weight and blood pressure and blood sugar down. Eat a little bit differently so that your cholesterol numbers might improve. Get into a tobacco cessation program so you can get off the cigarettes. And monitor your blood pressure so that your blood pressure numbers get back into the normal or
they should be.
Reduced.
Now, when it gets real bad, obviously that's when people see you. And how do you treat them? How do you treat people with heart disease?
So initially, the treatment is aimed at preventing progression of blocked arteries, and that's where we get into knowing your numbers and acting on them. Once it gets to a point where the blood supply to the heart is diminished and people start having symptoms of chest pain or angina, then we're looking at things like bypass surgery or coronary angioplasty. There's a video here which demonstrates how angioplasty is done, and this is a guide catheter that's being threaded up to the coronary artery, and that is a depiction of a blocked artery. You can see that there's a restriction there. A guide wire is then advanced across the blockage, and once that guide wire is in place so that it can guide the dilating balloon comes up and stretches the artery open, and then you have a pathway where we can put a stent in. This is a stent catheter that's being deployed, and what happens is then the balloon goes down and it is withdrawn, and you can see that the artery now has a normal caliper, normal diameter, and blood pressure is back to normal.
And you have one.
Or blood flow, yes. So everybody, I think, is a little bit surprised at how long these are. This is it looks like a long piece of spaghetti, and we put it in. They're preformed, and it goes in through the femoral area. And then
Which is in your leg?
In your leg.
Okay.
Yeah, and it can also be done through the wrist and through the arm.
Okay.
And then we have a guide wire.
That's kind of hard to see.
Yeah.
It's about the size of a human hair.
Okay.
And that is then threaded across the area of blockage.
Right.
And then finally, this is a stent catheter. Oops.
And this is what
Spaghetti
goes in
stent right
along
here.
the.
This goes
guide
over
wire.
over the guide wire, and there's a little crimped stent on a balloon. And then the balloon, when we get it in place, the balloon goes up. It expands the stent. The stent then serves as a sort of a structure to keep the blood flow open. Then the balloon comes out, and you're all finished.
Wow.
Now, you talked a little bit about what we can do to protect our heart, and let's go over those again because it's very important, starting with lowering your blood pressure.
Yeah.
Yeah, so what you can do, first of all, dietary habits are important. So for blood pressure, you want to minimize your salt intake. Exercise also helps lower blood pressure, so we want to see people, I encourage people to find some sort of exercise that they enjoy, whether it's swimming, biking, hiking, running, because if you don't enjoy it, you don't do it. So find something that you like. You want to be doing this aerobic exercise 3 to 5 times a week and gradually get to a point where you're doing it 20 to 30 minutes. And I don't care whether you go a mile, half a mile, quarter mile, get out there, do it 3 to 5 times a week, 20 to 30 minutes.
And cholesterol is important.
Cholesterol is critical, and if you know your numbers and your numbers are high and they're not coming down, which is the way my numbers were, get on some medication, because there are great medications out there that will lower your cholesterol and get you to where your target is.
And finally, stop smoking.
Absolutely. It's the easy thing to say. It's very difficult for people who are addicted to nicotine to do, but it's probably the best thing you can do if you're a smoker is to quit smoking.
All righty. Dr. Whelan, Chief of Cardiology at
Thanks so much.
PRMC. Thank you so much for coming and sharing all this. It's great information.
And if you would like to learn more from Peninsula Regional Medical Center about heart disease, including risk factors, prevention, and treatment, go to our website, delmarvalife.com, click on the show tab.
Well, as we just learned, you can fix some things that can lead to heart disease and some you can't, such as family history.
Yeah, many people are born with heart trouble, putting them at risk doing typical activities. Still ahead on Delmarva Life, that's the case with our next guest, young people living with congenital heart defects while offering hope to others in the same boat.
But first, how about another handy how-to tip from Rachel Ray?
Guys, here's a sweet double duty tip for a regular old household funnel. Spray the funnel with a little cooking spray, whip up a batch of your good old rice cereal treats, with the marshmallow, then put this inside this, let it cool, and it turns into a giant rice treat that'll look like a big kiss. So for Valentine's, you could print out a little message that says Happy Valentine, you could do Happy Birthday. It's a great way for the whole family to enjoy a big, sweet kiss.